JBN, we keep you informed. I am Michelle Jones, and in the news, 3, including pregnant woman killed in Manchester. The Manchester police are investigating the deaths of 3 people, including a pregnant woman, in the communities of Settlement and Williamsfield, which occurred on the night of Friday, September 18. Businessman Danon Simpson was shot dead shortly after 7 p.m. in the first incident at his family's drug center in Williamsfield. Simpson's father was also shot and has been hospitalized. Superintendent Gary Francis, head of the Manchester Police, said that Simpson's licensed firearm is missing. About 3 miles away in the second incident, which took place in Settlement, a man was shot and killed, and a pregnant woman found dead in a water tank shortly after 8 p.m. According to the police, a man was shot and killed in a house, and at the same time, the body of a female was found in a tank and is suspected to have drowned. Jail Peace Enriquez retains Clarendon Northwestern. The magisterial recount of ballots for Clarendon Northwestern has ended, with Philip Enriquez retaining the seat. The final tally showed Enriquez of the Jamaica Labour Party with 6,075 votes. The People's National Party's Richard Azan on 5,936, and independent candidate Michael Cohen with 47. A total of 276 ballots were rejected and 40 spoiled. The recount, which began on Tuesday in the Clarendon Parish Court, was initiated by the PNP after 1,107 ballots were rejected in the first tally. 3 shot, 1 fatally in downtown Kingston. 3 persons were shot, 1 fatally, when gunmen carried out an attack on Port Royal Street in downtown Kingston on Thursday. Stephen Hoffman, 25, of a Gold Street address in Kingston, was killed. It was reported that about 9 a.m., Hoffman was among a group of workers engaged in a road expansion project when a vehicle transporting a group of men drove up. The men opened fire, hitting 3 of the workers. They were taken to hospital where Hoffman was pronounced dead and the others admitted. Taxi operator dies in collision. 41-year-old Howard Lawrence, a Portland taxi operator, died of injuries he received in a motor vehicle collision on the Golden Grove Main Road in St. Mary yesterday. The police said Lawrence was traveling from Portland towards Onoto Bay and was allegedly trying to negotiate a corner when he lost control of a vehicle. The vehicle then ran into a ditch which crashed into a utility pole. The incident happened about 12:30 p.m. Lawrence was taken to the hospital where he was pronounced dead. Security Minister condemns the recent spate of killings. Minister of National Security Dr. Horace Chang has condemned the recent alleged coordinated attacks on police officers and their families, resulting in the death of 67-year-old Clifton Green, the father of a detective inspector of police who resided in St. Catherine. These targeted attacks on our police officers to disrupt law and order and incite public fear and panic are of grave concern and will not be tolerated. No stones will be left unturned in these matters, and the security forces will not rest until the perpetrators have been brought to justice, said Minister Chang. The minister, in assuring the public, added that under the leadership of Commissioner of Police, Major General Anthony Anderson, the Jamaica Constabulary Force will not be deterred and will be redoubling its efforts to dismantle gangs and restore peace and safety in communities. In noting that these incidents will not be allowed to impair the fight against crime, Dr. Chang said the bill to amend the anti-gang legislation was returned to the ministry recently. This administration will continue to work hard to strengthen the provisions of the anti-gang legislation to bolster prosecutions against gangsters while deterring crime, Dr. Chang said. Meanwhile, the minister expressed condolences to the family of 2 sisters who were murdered in Mona Commons recently, as well as a pregnant woman in Williamsfield, Manchester on Friday. He further appealed to citizens who may have information that can assist the police in their investigations to call Crime Stopper 311 or visit their nearest police station. Over 150 charged under Disaster Risk Management Act in Hanover. More than 150 persons have been arrested and charged under the Disaster Risk Management Act in Hanover, and over $1 million in fines collected in that parish court for the offense within the last 6 to 8 weeks. This as the Hanover police have stepped up their actions in mitigating the spread of COVID-19 among the residents. At a recent Hanover Municipal Corporation meeting, concerns were high as to the continuous rise in the number of positive cases of the virus being identified within the parish, with a resulting decision taken to convene a meeting of stakeholders to develop strategies to try and control the rate of spread of the disease within the parish. Superintendent of Police in charge of Hanover, Sharon Beeput, pointed out then that the Hanover Police continue to play their part in trying to get residents to adhere to the health protocols outlined. If all the judges in the parish had been charging the same amount for the offense, we would have cleared about $4 to $5 million in fines to date, she stated, adding that a number of persons are showing resentment when accosted by the police, including prominent individuals. We will continue to enforce the Disaster Risk Management Act across the parish, and any activity that falls within that purview will be dealt with in accordance with the law under that act, she emphasized. So if it is football, netball, volleyball, dance, the act will be applied, and there might be other additional acts like the Noise Abatement Act. Unlawful assembly under the Public Order Act might be also involved, as there are several acts that can deal with the containment of crowd and crowd control, and we will continue to adopt a zero-tolerance attitude towards these issues, she stated. As at Friday, September 18, 2020, Hanover had 44 confirmed coronavirus cases, with 471 individuals in home quarantine. Practical nurse schooling in disarray, fly-by-night trainees unable to do basic tasks. The lack of uniform standards for schools that train practical nurses has resulted in hundreds of health professionals graduating each year, still unable to perform vital tasks such as blood pressure checks. The matter is of serious concern for President of the Practical Nurses Association of Jamaica, PNAJ, Stephanie Powell, who said that she has been pressing in vain for a universal curriculum for these schools. Most of these schools out there, they're not teaching the same standards, so everybody's on a different level, she said. Programs run for as short as 6 months and to last as long as 18 months. They keep saying that because they're independently run, the government has nothing to do with them, said Powell. The PNAJ has more than 3,000 members. Powell is aware of more than 20 schools that offer courses in the field. But with the new ones coming on stream, it is difficult to keep track of how many are actually operating island-wide. The practical nurse notices that several have been making grand promises to attract students. At the end of these courses, they are graduating them and sending them out, and 3/4 of them can't get jobs, lamented Powell, who has been a practical nurse for more than 2 decades. She said that she has got several complaints from students who fear that they have been deceived after spending as much as $80,000 to be certified. She said of a concern that was recently raised by a student after signing up for a course. Her concern was that she should be going out to do a practical, and the persons from the school are telling her that she should go search for nursing homes that would take her to do a practicum, the association president said. You don't do that. If you're taking her money, you should find the place for her to do a practical. Principal of the Strategic Management and Training Consultants Limited Career Institute, Beverly Dinham Spencer, disclosed recently that she had come across many graduates who are unable to do vital checks. Her institution conducts skill assessments of allied health workers at the request of prospective employees. So far, we have found that about 90% of the persons who come in to do assessments have failed. Some of them are in shock when they fail, she said. Some of them knew that they were going to fail, and it says a lot about how we're training people. Much of the competence deficit surrounds the fact that many practical nurses are schooled in theory but have limited, if any, clinical practice. Many also cannot operate basic health equipment. Practical nurses are generally employed to give bedside care at health facilities such as hospitals, nursing homes, and care facilities for convalescents. They are often referred to as patient care assistants, helping to bathe and feed patients and collect vital data such as blood pressure and temperature readings. Training institutions are required to be certified by the Independent Schools Unit at the Ministry of Education, Youth and Information. But based on her observation, Powell does not believe all are following the regulations. She has noticed, too, that some of these schools disappear after operating for between 2 and 4 years. There was one young lady. When she was ready to go back for her certificate, the school was no longer in existence, Powell said. Schools brand faces. As October 5 resumption looms, face masks will be compulsory accessories when school reopens in October. But already students are taking issue that some administrators have made it mandatory for them to wear branded protection. The matter was highlighted by President of the Association of Principals and the Vice Principals, Linton Ware, on Thursday. But Ware insists that despite the complaints, branded masks are to ensure uniformity in schools. A phased reopening of schools will commence as scheduled on October 5, a government-appointed e-COVID management task force disclosed on Friday, adding that a risk profile will be developed. Resumption is likely to see a mixture of online and in-person classes. The ministry said that a vulnerability index will center on factors such as geoinformatics and demographic and health data. Education Minister Fayval Williams said that funds had been allocated to schools since June for the new academic year and pledged to revisit additional requests related to COVID-19 protocols. More than $4 billion has been allocated to public schools, with secondary institutions gobbling up the lion's share of $3.4 billion. As the COVID-19 threat lingers, parents will be required to provide masks for their children to attend face-to-face classes. Ware said that having them purchased branded cloth masks might be more cost-effective since these are reusable. They are able to wash them, they are able to iron them, that sort of thing, he said. Ware was responding to a concern that surgical masks were better options for students because they allow them to breathe easier. The surgical mask is a single use that is going to attract a lot of costs, said Ware, who is the principal of Old Harbour High School. The principal said that teachers will be asked to allow students to remove their mask periodically for a breather. It is going to be very, very important for our teachers and our students to work together, where we're going to have that time slot, where we're going to be saying to our teachers and our students, you can now remove your mask, he said. Principal of Harden High School, Nadeem Malloy, said that although branded masks are sold at the school for $500, students will not be mandated to wear them exclusively. She too said that students will be allowed to take off the mask occasionally. JBN, we keep you informed. Please remember to subscribe, like, share, leave us a comment, and click the notification bell to receive our daily news items.